Hey, good morning. This is Steve Stites back with you, broadcasting live from the Dolph Simons Family Studio. I am the Chief Medical Officer here at the University of Kansas Health System, joined on my right by Dana Hawkinson, who we always refer to as Hawkeye, Doc Hawk, a few other acronyms besides that. He's got a couple of guests he'll introduce in just a moment. I'm joined on my left by Dr. Joseph LeMaster from the Johnson County Public Health Department. He's a public health officer. And in Studio B by Dr. Jessica Kalendar-Rich, who's a national member of the Coronavirus Commission for Safety and Quality for Nursing Homes and Assisted Living. She's the geriatrician here at KU. Great folks here this morning. I know we're going to have a wonderful discussion. But before we do, Hawkeye.
Hi.
You got some guests, and you got some numbers.
I do. We do have Patrick Mahomes again with the mask.
With the mask. I like it. Let's go, Patrick. Big game today.
Another little bobblehead given to me by my infection prevention nurse team, who is excellent. He does have a mask. He's not wearing it right now, and my mom hasn't really had time to make a mask for him.
So your mom is your mask maker. I think he's probably this odd-looking bobblehead. I'm not really sure who he is drinking a cup of coffee, and that's why he can't.
That's right.
He's not wearing his mask yet. Who could that be, Hawkeye?
I don't know. We'll see.
All right, we'll figure it out.
We'll have the audience take a guess.
Mystery.
I would also like to say I was able to vote in person in Johnson County this weekend, which was a really good system. I had to wait in line about 30 to 35 minutes, so really not bad at all. Everybody had masks on. There were two gentlemen who just had face shields. I think their intentions were good, but I think we should point out that per World Health Organization, a face shield does not constitute barrier protection. If you want to wear a face shield, that's great. You can also wear eyeglasses, eye goggles, or other eye protection, but you really need that barrier protection of the mask. So.
And the other thing is that we saw in the freezer that the face shield, it directs the stuff down, and then it just kind of goes right around and forms your breath cloud again. Yes. So I'm not sure it's your friend, especially if the person next to you is shorter.
Yeah, right. that would not be good.
That would not be so
But definitely would encourage everybody to get out there and vote for sure. And there are, and I'm sure, and I think you voted in person, and I think the systems were good there and the protocol, so it is safe. But we really need everybody to get out and vote. So overall, the numbers are a lot better than they were on the weekend. We ended up having 37 patients in here at one point in the weekend for acute infections. We are down to 32 acute infections, but 11 of those are in the ICU and 8 of those are on the ventilator.
Those have sort of been stable here over the weekend. So a slower day yesterday, busier day Friday, Saturday, I think.
Correct. Yep. And we still do have 32 who are in that recovery period. So 60 plus beds that are being taken over by COVID, and for no other reason.
All right, well, we'll get to Doctors LeMaster and Kalendar-Rich in just a moment. First, Jill, let's find out if there are questions from media.
All right, I've got 3 that I can ask you while we wait to decide if the 3 reporters on the line want to ask anything. Kansas City Star had a question about over the weekend. Now, I'll probably say this wrong because I don't know this county, but Gove County, Kansas, G-O-V-E. All right. They apparently have an uptick and they have a spike, yet on their public health bulletin, which they provided, it has no mention of wearing masks. Right. It talks about social distancing and infection control, like wash your hands and cover your cough. How important is it that masks be on this same public health announcement?
Yeah, I don't know that website, so I can't comment on that. I think this is really a question, is mask wearing an important part of infection control? I think you're going to say yes. I'm going to go and ask Dr. LeMaster as a public health official. Joe, that's really important.
It's extremely important. It's part of our first line of defense in terms of social distancing and other measures to reduce the incidence of the disease. What's happened, I'm not sure about Gove County because there are a number of counties who've made these decisions. In a number of places, there have been discussions between the local health officers and the county boards of commission in these places, and decisions were made in many counties around Kansas not to affirm the governor's executive order for masks that came out a couple of months ago. In some counties those were reversed and the mask order was put in place, but not in all counties. And so that discussion continues between public health and the elected boards of commission in each of the counties. So that could be the case in Gove County. It could be that the reason why it's not there is because that mandate is not in place. I can't speak for Gove particularly. There's lots of counties where we're seeing this uptick.
Yeah, and we know that the mask wearing is an incredible part of our barrier protection. Remember that Swiss cheese model we showed over the weekend and the different, or last Friday, of the different things you can do in infection prevention control to prevent COVID from breaking through to you. Social distancing is certainly one. Staying home if you're sick, that's another one. Wash your hands, that's great. Mask wearing is incredibly important. It's really at the heart of this. And we know that in places where they do wear masks, the infection is much better controlled than places they don't. The proof is in the infection.
And I would like to say, yeah, masking is absolutely vitally important. This is in direct contradiction to those data points that were misconstrued in that CDC article that looked at saying 85% of people who wore a mask got an infection. That was a misinterpretation of the data points. The actual point of that article was that people who ate at restaurants within the past 2 weeks were actually at a significantly higher risk of getting the infection. It had nothing to do with the masking. So
Yeah, and in fact, most people who are eating at restaurants don't have a mask on.
They don't.
There you go.
All right. Betsy Webster had a question about ionization and other kinds of sprays and cleaners that you can use in public settings like airplanes. A good thing?
Yeah. I don't know as much about the ionization. Maybe you two guys do. I'm not as familiar. Or Jessica, if you know, I am not as familiar with that. I think the key is that the things we know from an infection prevention control standpoint that work are negative airflow or lots of room changes, wearing a mask, washing your hands, keeping your distance, guys, ionization.
yeah, I think if you're in a densely populated area, whether that's a small room that has bad ventilation or in an airplane that you're packed close together with people, I think any of those instances, it's really not going to change. The main issues are the non-pharmaceutical interventions, the distancing, the not gathering, the masking. All of these other interventions, I think they can be helpful. They probably will not be detrimental at all, as long as the EPA evaluates and makes sure that it's within healthy levels. So I don't think it'll harm. How effective will it be? It won't be as effective as those interventions that we've talked about.
Jessica, any other thoughts? Or Joe?
We focus a lot in the nursing facility setting, right, where I practice the most on making sure that all of the ventilation is up to date. Mm-hmm. And as we actually move forward into opening and allowing visitors in, we really encourage those facilities just to make sure their open air spacing is really set up and everything has been recently reviewed and examined from a regulatory standpoint. But we haven't really moved forward with recommending things like the ionization at this point.
All right, and then CNN had 2 or 3 questions, and I think I'm going to pick 3 and start with, and we've had local media asking this as well. Have we had to turn away any ambulances here or at our other health hospitals across greater Kansas because of COVID patients overwhelming us?
Yeah, that question is a wonky question. So we're going to talk about diversion and then turning away. So if an ambulance comes up, are we turning it away? No. Have we been on diversion from time to time? That happens across the city when you get really full, though by and large, hospitals agreed to give up going on diversion about a year and a half ago. So we don't really go on diversion anymore. We are not turning away patients, or COVID patients in particular, because we're too full of COVID patients. I think that would be a false statement. I don't know, Joe, have you heard anything different? No. And I don't think anybody else. So now I can't speak about Hays or Great Bend or Pawnee Valley. I'm not certain about those, but I would be very surprised. We can go find out and double check that, but I don't think we have in Hays either.
And CNN also would like to know, what do you think is causing the uptick here in the metro and across greater Kansas? Is it difference?
No, I think it's what we always say, Joseph, right?
That's right. I think the main issue that we're seeing is that in places where there are not social distancing mandates going on, where people are not mandated to wear a mask, obviously they're not, and then there is issues about people actually following through and actually doing what is necessary to be able to reduce transmission. So it really gets back to the main thing, as Dr. Fauci said so many times. Social distancing is the main thing that we have right now to reduce the transmission, and we need to all be doing it.
And I think we need to understand that it's all these things. It's gathering. It's getting out and doing those things that we weren't doing before. And it doesn't mean if there's a gathering that a week later you're going to have a huge explosion in cases. That's not what happened. If you look at Sturgis, there's the new article out in New York Times right now.
Yeah.
There was a huge spread of the disease from that Sturgis event. And it didn't happen a week later, but it happens in 2 or 3 or 4 infection cycles, because one person can infect 2 or 3. They go out to infect 2 or 3. They may work at a restaurant. They may work at a nursing facility where those vulnerable populations are. So they spread it. Same thing as the wedding up in Maine as well. It takes 2 or 3 or 4 infection cycles for it to be really evident. But I think it's a combination of all those people, all those things, and people getting out and being in those large gatherings.
Let's talk about schools, because we know that's going to come up there. So we get nervous about that. So Dr. LeMaster, where do you think the schools, what role do the opening of schools play in the increasing numbers in Kansas, Missouri, and in Kansas City metropolitan area?
Well, the way that we've sort of approached it is, and the way that we're thinking about it, is that if schools are really a measure of when we start to see schools open, and when we want to see schools open, we want to do that by looking at what's going on in transmission in the community as a whole. Especially in young school kids, we don't think that a lot of the transmission is happening between the children, for instance, in grade school. But when we start having a high amount of transmission in the community, then we'll start seeing more transmission in the schools. And if school kids get infected, then they go home to their families, maybe vulnerable people in the families. And so we're continuing to keep a very close eye on what's going on with the levels of transmission as we make decisions about whether to open the schools or not. They certainly are all open in some degree. There's hybrid programs going on, I think, throughout at least the county that I'm responsible for, Johnson County. But there are in various places. Some of the counties have been a little bit more restrictive. I think Wyandotte County is now still predominantly doing everything by remote. But I think that when we start to see the transmission rate going back down, I think that currently we say less than 50 per 100,000 is the cutoff where we would go back to 100% in-person education. Then I think it'll be possible to open things up a little more. Right now, transmission rates are just too high for that.
And I think that the schools probably could be safe, the physical buildings, and when they're doing school, they are trying to de-densify. We have to remember that these young people are getting together outside of school, and there are gatherings, whether it's sports or clusters of people hanging out at a house or overnight parties, things of that nature, and that's when it becomes really dangerous.
Yeah.
And we know that it takes that first 2, 3, 4, 6, 8 weeks to really see the effect of this as it continues to magnify and trend and move to older folks who could be sicker.
And Channel 9 and CNN both want to know your biggest concerns and worries about the weather getting cold. We're feeling colder weather here and across much of the states.
Yeah, well, we know what happens when it gets colder. People tend to go inside, right?
That's right.
They don't go outside. Yeah. If you go inside, you stay inside. That's one thing. If you go inside, you bring other people inside your home, you mix all your bubbles up. That makes us all a little bit more nervous, I think. And if restaurants say we got to stay open, which, I understand the business aspect of that, but if you bring people in and they get crowded, that's going to be tough. And outside is always better than inside. And when it comes to airflow dynamics around any infectious disease, of which coronavirus is clearly one. So I think that the risk is always that crowds of people will come inside together, mix their bubbles, and then infection spreads. And I think that's what we're worried about. It's not just that people go inside, it's what happens when they go inside with the dynamics of who they interact with.
Okay, I'm out of questions from media,
right.
So you guys can go ahead and proceed.
I want to talk to these guys for a minute. So Jess, let's start with you. So how are we in nursing homes? What's going on out there? How you doing? You look like you got a little sun this weekend, just saying.
I think it might be the lighting in here.
That's it.
The nursing home world has been really up and down, but generally speaking, it's been mostly up. We have seen that as community transmission has waxed and waned, it certainly has followed. We're seeing smaller outbreaks out in the nursing homes. I think that's because we know more. We know how to, use the right infection prevention and control measures in that setting of care. But we're still seeing outbreaks really across the wide breadth of facilities. 1 and 2 cases here and there. And that's actually been slowed down, I think, because we have a new rule set by CMS where actually all the staff is getting tested regularly based on the community levels of spread. And so we're able to sort of clamp down more quickly before these big, huge outbreaks have occurred.
Yeah, good. And what about visitors in nursing homes? Where are we with that?
Yeah, that's a great question. Visiting is opening. So it actually came down as a mandate that the facilities needed to open and allow visitors to come in. That is with a lot of restrictions, though. There's a lot of screening that has to happen. The facilities are required to keep a log, of course, of everyone who comes in. They're also required to do visiting. It's usually going to be time spaced out because they have to have enough, distancing. So they might have only one large room in their facility, depending on how the layout is. And, that might mean that one person gets to visit their loved one once a week for 30 minutes or whatever that facility is able to do. But quite frankly, at this point, something is better than nothing. We have to get these people able to see their loved ones. We were hoping for a little bit longer fall warm weather because outdoor visits are certainly, the best thing that we could do. Back to the points earlier about being outside and the airflow that can occur out there. But that being said, we have seen this start popping up all over the country, and there have been, as of yet, no reported outbreaks as a result of these visitors.
Yeah, that's a great thing. Let's keep it that way. We hope that will keep working. Dr. LeMaster, talk to us about Johnson County. How do you feel about the county? How do you feel about the numbers? How are we doing?
Right. Well, as you know, Steve, the numbers have continued to be pretty high since July. We call it the sort of high, bumpy plateau as we move forward in time, because the number of cases has continued to be somewhere in the neighborhood of 200 cases a day, somewhere it's sort of up and down between 150 and 200, and it can sometimes be kind of nervous. We're kind of nervous about what's going on. In particular, as we move forward into the late fall and the winter and the temperatures begin to get colder, as we talked about before, we would anticipate to see those numbers actually go higher. A lot will depend, I think, on what happens in terms of the legal situation also. If we see the governor's emergency declaration in mid-November expire and not be re-renewed, then we have to also then think locally about what we would do in terms of the same kind of social distancing things that we've got going on right now. Right now we've got the mask mandate in place. It's hard to see what would happen if we went to a situation where we didn't have an emergency authorization going on. So right now, I think we feel like that it's in a pretty good situation. We're trying to get a better handle on what's going on in terms of the hospitals in the region. As you know, there have been a lot of COVID admissions across the hospitals in the metro. I think somewhere in the neighborhood of 100 to 120 a day in the metro region in recent days. Currently, as far as we're aware, all of the hospitals have got capacity, both in their ICUs and ventilators and all the things related to that. So we're not at a point where we feel like we're tipping over into being inundated or overwhelmed, but it's a situation that we have to keep in close eye on. You mentioned Gove County, and we've got a number of counties in rural Missouri, in rural Kansas, that depend on us as tertiary referral centers, and if they begin to become overwhelmed, then we need to be able to help them out. So that's a situation we're needing to keep a very close eye on and be able to be sure that we can cope with that if it happens.
Yeah, these are tough times, and I know we're all a little bit nervous about what's going on. We look at the numbers every day, and we get a little nervous. We do the chief medical officer calls, and those numbers are creeping up, and we hear it. I think we hit a record last week for our CMO call for the number of inpatients with COVID. We're at 231, or so. I don't know the exact number. It's a high number for us, and I think, gosh, we'd really like to see that slow down a little bit.
Yeah.
All right, Jill, let's start with some questions and see what questions are from our listening audience.
Yeah, Carol wants to know, could Dr. LeMasters explain the new methodology for calculating positivity rates in Johnson County? We went from 11%-ish to 6% like overnight.
Right. So we've had a lot of questions about this, and it's important for people to understand what's going on. So previously, when we were at the higher percent rates, the way that we were calculating that figure was based on the total number of people who had been tested right from the beginning. So the denominator, remember, any percentage is going to have some number over another number. So at the point where we were at, let's say, 11%, we were looking at the total number of positive cases in the last 2 weeks over the total number of people that had been tested right from the beginning. So once you were tested, let's say back in April, even if you were negative, you stayed in the denominator. That meant that the total number of people that had been tested wasn't really reflecting what was happening in the recent past. So we shifted that and started counting people that were tested in each 2-week period. So if you were tested back in April and you were negative, then you were tested again in the last 2 weeks, you'd have come into the denominator again in the last 2 weeks. So that's giving us sort of a more accurate reflection on the percentage of tests that are being done in a 2-week period. So this is, I think, an important point to make overall, is that as we're watching these percent positivity rates, we're using this as a means of making sure that we're getting enough tests done. We're also using it to some degree to guide whether we reopen schools, but it's important to realize that even where it is now, it's still too high, and in particular, the incidence rate, the number of cases per 100,000 is still too high. And we're looking at both of those to guide us in directions about recommendations to the schools. So that's a real important thing to know.
Joe, is it fair to say that if you were to apply that same testing methodology over time, you'd still say that today there's more people testing positive than there was 2 months ago or 3 months ago?
Yes, overall, in terms of the total numbers, I think that some of the especially in the metro, that would be true. I think we're seeing some variation across the different areas of the metro, but overall, I'd say that's true.
Melissa, she has 2 questions. It begins with her son, who is a type 1 diabetic, and he tested positive. He's feeling lousy. She's worried about him and wants to know, is there anything specific that he should be watching for or looking for, and when should he seek medical attention?
Yeah, the number one thing is to call your primary care doctor and get them involved in that, in your son's care, because it's hard on this program for us to analyze somebody's health. But in general, the things we would say, diabetes, the blood sugar starts to go either too high or too low, start getting short of breath, you're not able to take in food or fluid, then it's time to get a hold of your primary care doctor. But I even say right at the outset, testing positive, type 1 diabetic, get a hold of your primary care doctor and let them walk you through that. Because I think, Joe, as a family practice doctor, you'd want to know that as soon as somebody tested positive.
Absolutely.
Great. Yeah.
And the second part of her question is, she says that he lives with his girlfriend, and her employer has told her as long as she is symptom-free, she can continue to work. Does that sound correct?
Well, I think it probably is these days, as long as people wear masks. But take it on.
Yeah, this is, I think,
It's a hard one.
yeah. This is, I think, a lot of employers are starting to use this sort of modified quarantine rule, where they have people that are that need to work, who are in like essential services, wearing masks and doing social distancing. Overall, generally speaking, what we recommend is that people who are close contacts of people who are cases should be in a quarantine situation if they possibly can. That usually means not going to work and staying home and or working from home during that 14-day period. If the organization you work for, which often would be a healthcare organization, has some kind of modified quarantine rule, then that may be something that you're able to do. But it's usually, that decision is not made at the individual level by the patient. That's a decision that's made by the organization that you work with. And generally through some kind of liaison or discussion with public health in the county where you're at. So I would say, if you have questions about whether or not your organization has had those conversations with public health, that's a good question to ask.
Hawk, what's our policy here at KU these days?
Yeah, we still do. So absolutely, if you can't isolate in the home from the contact or from the actual case to the other people in the home, try and do that. It starts in the home. Certainly here, because of workforce issues and the healthcare facility and essential workers, we are allowing people to work. But again, we have strict measures with universal masking, also eye protection for any patient interaction. So we have those protocols and systems in place as well here.
To help a little bit. And obviously, if you start to test positive, and if you can work from home, that's the preferred choice. Jess, what's going on in the nursing homes?
I think we really function similarly to the hospitals in that setting. if people have been, our contact, and certainly they're monitored. But we have that benefit of this routine testing that happens, once weekly, twice weekly, or if cases are really, really low in a particular county, then once monthly. And so while we are able to let people, continue working with, universal masking and eye protection, we still are also doing different types of asymptomatic testing than is taking place in many other settings.
So how often do the employees in a nursing home get tested in areas where there's a higher incidence? Let's say in the Kansas City metropolitan area, obviously on the Kansas side.
Yeah, so it's actually based on county, and we follow the percent positivity over the past 2 weeks. And so if they are under 5%, then the employees are tested once monthly. If it's 5 to 10%, they're tested weekly. And if the percent positivity is over 10%, they're actually tested twice weekly. And the government actually provided them with some antigen tests, so some rapid tests that they can do on site that were intended for that purpose, or also certainly many are contracting out with local private labs to get that testing done.
So it's not all just a brain biopsy test. That there's those. Are you guys doing saliva? How are you doing it?
So different places are doing different tests. Many of us are doing just an anterior nasal swab, so just the front of the nose. Very few brain biopsies happening, and other groups are doing the saliva tests. Really, we've seen that as prices have come down on different types of testing, some of this cost does fall on the facility, and so they're able to make up for it by using the tests that are both safe, effective, but also less costly.
Okay.
Annie is a pre-K teacher. She tested positive October 7th. She isolated. Yesterday, she tested positive again. She says, should I return on Wednesday? Am I still shedding virus? By the way, I still have a cough, loss of smell, and other symptoms.
Hawk, people can stay positive for quite a while, especially with the PCR test. That was one of the complaints about the PCR test, is you can stay positive for a very long time.
Yeah.
This is a little different if she still has symptoms.
Yeah, exactly. The first thing I would recommend is stop testing. The CDC guidance is really to remain in isolation for 10 days past your symptom onset, so I would certainly do that. I probably wouldn't test anymore. Your symptoms should be improving within those 10 days. If they are not improving or getting worse, please call your physician. But the best thing we understand about, especially in those with mild to moderate disease or no symptoms at all, is really the viral replication is really stopped and halted by the immune system by about 8 to 9 days. So remain in isolation for those 10 days. After that 10 days, you should be able to get back into society per CDC guidance. Obviously, you're going to want to wear masks and do those things. The symptoms, however, can persist, especially symptoms such as fatigue, cough, aches. Those can persist on for several weeks. But overall, getting back into society and getting back to work, it's really going to be that 10 days from your initial symptom onset. But please make sure that when you do go back to work, you are following the other guidance, the physical distancing, the masking, the hand hygiene, and things of that nature.
And really, cough can go on for quite a while post
Yeah.
any viral infection. We see it often go on for 6 to 8 weeks, as long as it's improving. The other key thing that we don't know about is, are you afebrile? If you're still febrile, that's a difference maker. Then you can't go back. But if your fevers are gone and your temperature and your symptoms have improved, you're probably okay to go back to work after 10 days. So I think we'd all agree.
Yes.
And what did you say? Afebrile?
Afebrile. If you don't have a temperature,
Okay.
which means you're afebrile. Sorry about that. Hospital slang.
Yeah.
If your temperature is improved and you're not on Tylenol or Motrin or one of those drugs, your temperature's gone without that, and your symptoms are markedly improved, then you can go back to work after 10 days. If, however, you still have a fever, you can't go back to work then. That says you still have ongoing viral, and you still could be somebody
Kind
who
of
could
same
shed
with
the
flu
virus.
then, too.
Yeah. Yep.
And I learned a new word.
You
Thank
did learn a little. Look at this.
Yeah,
Watch
I
out.
know.
We are rocking
Here,
it
10
this
years
on a
and I'm
Monday
still
morning.
learning.
We're
Yeah.
rocking on a Monday.
Okay, Kathy is writing to us from Alaska. She says that she was notified this morning that 5 staff members where her mother is in long-term care have tested positive. So she's got her mom wearing a mask when she leaves her room, and when staff enters her room, they use Lysol spray. But she says, and she uses hand sanitizer, but she says the staff have to bathe her mom and get close to her. She wants to know, what else can I do to protect my mom? I'm worried.
Great question, Jess. That's right up your alley.
Yeah, that's a really great question. I think we're all trying to figure out how to best protect our loved ones, especially when we can't get in there and really take care of them ourselves. And I think that everybody wearing a mask in that room, and clearly your mom probably can't wear one when she is being bathed. But if everybody else in the room is wearing a mask, wearing eye protection, they really are protecting her as best they can. And they're all going to be they're required to wear not cloth masks, but real surgical masks, or potentially even higher level masks if they have an active outbreak going on. But those things are all meant to protect both the staff, but also, and very importantly, the residents of that facility.
Okay, so it sounds like they're trying to do all the right things in that situation, and I guess during a bath, mom can't wear a mask, although if they're not washing her face, maybe they could try keeping her mask on during that. Okay, you look at me like I'm crazy. I know that look from Jessica Kalendar-Rich. I've seen it before.
Linda wants to know, did we give Hayes numbers?
We did not
get Hayes. Actually. Good question.
So Hayes has 16 inpatients right now. 14 of those are active, 2 are in the recovery phase. So they are down a little bit, which is good.
Yeah, they're down about 10% then. Good.
Elizabeth and Donna were both out over the weekend, or have knowledge of people that were shopping, doing weddings, sorority, dad-daughter events, and having a stays in Vegas, happens in Vegas, stays in Vegas kind of attitude, because mask wearing intermittent, non-existent, under the nose. And they just want you to talk about that. There's a lot of frustration in the messages from these women.
There should be, because it's just so darn disturbing, because we've been trying to talk about it. So I was out a little bit this weekend, not a lot. I've kind of sheltered in a little bit more as the numbers have risen, and I'm 60 years old, and okay, I'm going to try and play it safely. I was down in the plaza for a little while Saturday afternoon, and I have to say, people were wearing their masks even outside walking around. I was really happy. I thought, this is so much better than it was a few months ago. And then, of course, everybody inside the businesses were wearing their mask. And really, I didn't see a lot of the people who decided that the nose wasn't really part of the respiratory system. And so they still had the mask over their nose. It was really good. And then I was in the grocery store, and that was really good. I stopped and get gas, went to a gas station. That was really good. So that was a good experience relative to what I've seen a lot of times. But I do share the frustration of this listener, because we know that mask wearing is the single most important barrier you can provide. Face shields, we saw that down in the freezer. The air just goes down and around you. Not so good. When you pull the mask over your nose, it just comes pouring out of your nose. Sometime in the next few weeks it's going to get really cold, and people should go out and do their own freezer test. This needs to get below 32. It's coming on, and as soon as it does, I challenge all of our listeners to take all your friends outside and take a deep breath and blow it out and see where your cloud goes. Then put a mask on and try the same experiment. It's what we were doing in the middle of the summer. But if you can do it at home, and maybe that'll help convince you, because it is just ridiculous. Oops, sorry, maybe I'm too strong a language here. No, I'm not. It's just ridiculous that people still want to politicize something that saves lives. Joe?
I could not agree more, Steve. I think that the situation currently is that this has become a very divisive issue, unnecessarily, I think. I think we continue to hear week by week public comment at the Board of County Commissioners meetings about this, for people that feel that wearing a mask is a violation of their rights, and I think that for a lot of people, this issue has become one that has gotten outside of just disease transmission. There's also, I think, some folks who believe that all that we're reporting from a public health perspective, that the numbers are wrong, that the data's off, and that we're not really doing the job that we need to do to try and keep people safe. The only thing that I can say is that all of the agencies that we're working with have been doing the same kind of public health work for the last 60 years, plus years, and that we're still doing things in science, in medical science, in publications, and in all the things that we're bringing out. All of this is real. This is not something that we've just made up. Over 200,000 people have died as a result of this. More people are dying every day. This is not, this is not something that we need to be divided over. Absolutely, it's something that we don't want to see politicized, and yet we know it is. But on the other hand, if you're in a situation and other people around you are not wearing masks and you're in some social situation, there is the kind of herd mentality that other people aren't wearing it. I'm not going to wear it because, you know, I think I don't want to look, you know, strange, or people to think strange things about me. We need to all get over all this. It needs to become normalized, and we need to have, especially in gatherings where people are at. First off, if you're in Johnson County and if you're in Wyandotte County, it's the law. If you're in an inside space where you're gathering with other people, it's the law. You're supposed to be doing that. I was really encouraged to hear Dr. Stites tell me today that this is a negative airflow room.
It is. We have a special room here. Actually, I did check the flow dynamics here. We're pretty good.
That's right.
We have 100% outside air, and the air turns over every, what did I just do? 8 minutes. So
8 minutes.
It's pretty good.
Yeah. So, you know, but it's really important that we do this. So I think
It really is.
Absolutely.
And, you know, the funny thing to me is that people say, well, what happens in Vegas stays in Vegas. Well, you see, the virus doesn't act like that.
No. No.
I know that sounds great, but you see, coronavirus, we said it before, doesn't care what you think. Coronavirus doesn't care if you're Republican or Democrat, red state, blue state. Doesn't care if you're rich or poor. Coronavirus doesn't care if you're in Vegas or not. Coronavirus goes out. So it really doesn't stay in Vegas. You can say, hey, nobody will know. Yeah, and when a bunch of people get sick, you're going to feel real bad. And what price did you just pay to not wear a mask? Yeah. And who did you just make sick? Because, see, that's the other problem. It's not about you.
That's right.
You can say, well, I don't want to wear a mask. Well, it's not really about you, right? It's about all the people around you who you can make sick when you're asymptomatic. How bad will you feel if by not wearing a mask you took somebody's life? How bad would you feel? Because that's really the question, right? The question is, do you want to wear a mask? Well, nobody wants to wear a mask. The surgeons don't want to wear a mask in the operating room. We're in a mask of pain. Who wants to wear a mask? Do they just really like wearing masks? No.
Even the people in the ER do not like wearing the N95s.
Nobody likes wearing a mask. And yet, do you want your surgeon to go to do your operation without a mask on so they can breathe all over you and get your wound infected? Yeah, probably not. That would be a really dumb idea. This is not about you.
Yeah.
This is about everyone else and keeping everybody safe. Freedom with responsibility. If you really know your American history, you'll know that's actually the message. It wasn't just freedom. It was freedom with responsibility. That's why they fought so hard to have a Declaration of Independence and worked so hard to write a Constitution. Freedom with responsibility.
So there's a question, do you know what's happening at Lakeview Village in Lenexa? They had a friend who tested negative but has still been moved to a different location and believes he's surrounded by 20 or so positive cases.
Well, that would be
Is it
Jessica who
COVID?
might know, or Joe.
No, I don't know about that one, so.
Jess, do you know?
I don't want to speak specifically to any one facility. I know that they have had a few cases, and that can be found, on the Johnson County dashboard to sort of follow that along. We have some really strict protocols in place in every facility that's out there that relate to really having to move people to cohort people that are exposed, people that are testing positive, people that are not exposed and not testing positive. And overall, the most important thing is that everybody's being watched, everybody's being monitored, and everybody is being treated in the safest way that they possibly can.
All right, Mia wants to know, a friend has told her this surge is a less deadly strain, but I'm at high risk still at home. Is the less deadly statement true?
Yeah, Hawkeye. I don't think that we know that. I'm thinking it's not a less deadly strain. It may not have been into the same population yet.
It's absolutely not true. We have many, many isolates that we've recovered from active cases since the original Wuhan strain till now. The strain is the same. The original strain from Wuhan is the same now. Because there are mutations, and we know that with RNA viruses, which this is an RNA viruses, mutations happen all the time. 9 times out of 10, those mutations are deleterious or very bad for the virus. But clinically and physically, the virus is the same exact virus as it was in Wuhan. There are really no changes from that. If you would have gotten the virus in Wuhan, you would have gotten the virus now. It's clinically the same virus. So there is no clinically different strain from the original strain. What has changed Number one are the widespread non-pharmaceutical interventions to try and help the spread, although we can see that it is still spreading because of individual actions. The other thing that has changed that we have talked about is our ability to manage these patients a lot better. Also, we've seen that a more percentage of the new cases seem to be in that younger age group, and we know that the younger age groups have to go to the hospital less and have critical illness less. But it's really a combination of all those things. So there is no clinically different strain that we've identified at this point, despite identifying many different isolates from the original strain till now throughout many, many countries, and identifying, I think it was up where around tens of thousands of mutations. Any one virus can have 5 to 10 mutations from another isolate, but those isolates are not clinically different. They are the same clinical strain. They cause the same clinical illness.
One more question. Here we go. Last
All
one.
right, yeah. People are wanting to know, how do you, if it's the law, as you mentioned, how do they report and what do you want to know if a business is not following?
Great question.
Right. So this, of course, varies by county. So I'm going to speak towards Johnson County because that's the county in which I have closest relationship. So the way that we're doing it there is for you to report this to the district attorneys of Johnson County. You can find that number on the Johnson County website, jocogov.org. The information would be the date and time that you saw this happen, where the location and the address was, any and all information that you're able to provide. It's important to realize that there are many of these reports coming in, and so the district attorney's office is trying to prioritize what they do with respect to responding to these things. We're not currently issuing citations for violations in Johnson County. It's more on a case of on each of the individual reports being individually investigated to decide what we're going to do about them.
All right. Well, thank you. And thanks to all of our guests today for a great thing. Jess, final thoughts for this morning?
You know, I think my final thoughts are echoed by everyone else's. We are out here to protect all of our vulnerable population, and for me, that means the older adults in our communities and our nursing facilities. So let's do our best, wear a mask, physically distance, and everybody hang out around fire pits outside this winter.
I like it.
Yeah.
I guess my last one would be, we got Halloween coming up in just a very short period of time. We put a number of videos on the Johnson County website around that. The main messages are avoid parties and large gatherings of people inside where people are not wearing face coverings or socially distancing. Probably not a good idea to have a lot of trick-or-treating happening, or if you do it in a very safe way, be very careful about how that's done. We provided some guidance on the Johnson County website about that, so we'd refer you to that.
Great stuff. Hawk?
Yeah, not to belabor it anymore, I think you said it perfectly. It was brought up in the question, what happens in Vegas stays in Vegas. That's not true. That's until it gets to a nursing home in Vegas, or one of the vulnerable populations who's sitting at a slot machine in Vegas, or jumps on a plane and comes here. And the other thing is, the masks are not chin diapers. I was at a store last week, and they had a very good sign out front at I. Donnelly saying the mask needs to cover your nose, your mouth, and your chin. And that's the proper way to wear a mask. We know that many times it is just underneath the nose, but it needs to cover both your nose and your mouth. So.
You know what we want to do? We want to keep Patrick safe. We want to keep Hawkeye safe, because we want to keep us all safe. And that's how we do this right. Hey, we got a couple of mask photos here, but first, tomorrow, Phil Griffin, the KDHA Director of the Bureau of Disease Prevention, is going to update us on how a COVID-19 vaccine would roll out across Kansas. Who's going to get it? Who's not going to get it? Hopefully everybody's going to get it, because we think that's absolutely the right way to go. Remember to send us your mask photos. Susan shares her mask with Daisy. She works at the KU School of Nursing. I don't think Daisy does, but I think probably Susan. Margene from America's Kansas writes, I'm 69 years old and a cancer survivor. I have no trouble wearing a mask and don't have to smile when my family says, say cheese. They can't tell if I'm smiling. Awesome. I mean, you see, that's where I would wear a mask right there. That's it. Diane says 3-year-old Zach likes sharing his shark mask when watching his big brother play sports. As we close, this week is International Infection Prevention and Control Week. If you're on Instagram, you may want to follow one of our infection control nurses, as she will be sharing about her day in the life of preventing the spread of all diseases that threaten the public's health. Here's a preview in her own words. Be safe, practice your pillars of infection control. Remember, they go with you wherever you go. And remember, the mask is not a political tool. The masks were invented to keep people safe. They control infection every single day in the hospital, in the emergency room, in the operating room. The hottest hotspot in any area is the inpatient ward in a hospital where there are COVID-19 patients all together. And how much spread do we see when people wear infection control? And the answer is, we don't see spread. That's the proof. And we have no reason to lie. That's the proof. That's what you should believe in. Believe in the truth and believe in the science. We'll be here tomorrow. You're going to see this video, but there's still no place like home.
Hi, I'm Tiffany Horsley. I'm one of the infection preventionists at the University of Kansas Health System. You might not have heard of infection prevention before COVID-19, but we've always been here working behind the scenes to keep you safe. This week we're celebrating International Infection Prevention Week in conjunction with APIC, the Association for Professionals in Infection Prevention and Control. APIC's mission for over 30 years has been to create a safer world through the prevention of infections. If you were wondering what an infection preventionist does all day, you can watch me on the APIC Instagram channel at APIC_infection_prevention. You can also go to www.apic.org to learn more about infection prevention and find helpful resources for how you can keep yourself safe during this time. And if you know an infection preventionist, be sure to tell them thanks.